For the longest time, AI was something that lived on servers in the world of software. But that's changing. It's moving into a totally new space our hospitals, our clinics, and yeah, even into our own bloodstreams. So let's get right into it because this isn't some far off prediction anymore. This is what's happening in medicine right now.
And right away, that brings up the big question, right? The one that's probably on your mind too. Are we about to hand over the incredibly human art of healing to cold, unfeeling algorithms? Will doctors be replaced? That's the tension. That's the core of what we're going to unpack.
You see, the whole reason we're even having this conversation is because of this massive, fundamental shift. The simple truth is, medicine isn't just a human thing anymore. It's becoming computational. It's this new hybrid, a real partnership between our biology and raw data. Okay, so when we talk about AI in medicine, what are we really talking about? It's not some single, magical, all-knowing machine from a movie. A much better way to think about it is like a brand new digital toolkit for doctors. And to really get what's coming, you have to understand the different tools in that kit.
And we can basically break this down into 5 layers, each one building on the last. First up, you've got prediction systems, which are all about forecasting disease before you even have symptoms. Then you have diagnostic models, which can read scans and lab results like a superhuman. From there, it gets wild. Digital twins, virtual copies of you to test things on. That leads to automated treatment, delivering care with incredible precision. And finally, the bleeding edge, generative biology, where AI actually invents brand new drugs from the ground up. Now, that first layer, prediction, is maybe the biggest game changer of all. Think about it. For pretty much all of history, medicine has been reactive. You get sick, you go to the doctor. We treat a heart attack after it happens. But AI flips that script. It allows us to be predictive. We can move from just dealing with the emergency to identifying someone who's at high risk 5 years before that emergency ever happens. That changes absolutely everything. All right, let's move on to the next layer, diagnostics. This is probably the one that's easiest to wrap your head around. It's all about AI's incredible ability to see things that are just, well, they're invisible to the human eye. And this isn't coming soon. It's already here. I mean, get this. We have AI models right now that are looking at medical scans and spotting lung cancer, finding signs of eye disease before a person feels the thing, and identifying skin cancer with way higher accuracy than humans. There have even been studies where an AI found signs of breast cancer in a mammogram a whole year before a human radiologist could see it. It's not just seeing better, it's seeing patterns that our brains just can't process. And then you have to think about this scale. It's just staggering. A single AI system can churn through more than 1 million scans in a year. It doesn't get tired, it doesn't need a lunch break. Its analysis at 3 in the morning is just as sharp as it was at 9 in the morning. So it's that combination, superhuman sight and superhuman stamina, that makes it such a huge deal.
Okay, so AI can see what's already there. But what about what's coming? That's the next great leap forward. We're talking about creating a virtual you, a digital twin. So what exactly is a digital twin? It sounds like pure sci-fi, right? Well, it's a super complex computer model of your own specific biology. It pulls in your genes, your lab work, your lifestyle, all of it to build a virtual version of you that doctors can use as a kind of medical crash test dummy. And this is where it gets really, really powerful. Instead of a doctor having to make an educated guess about which treatment will work for you, they can just test them out on your digital twin first. They can simulate how a tumor will grow, see which chemo drug works best with the fewest side effects, or even predict how your heart will react to a new medicine. It's basically trial and error medicine without the patient having to suffer through any of the errors. Okay, so all of this amazing tech brings us right back to where we started. With tools this powerful, is the doctor's job in danger? And the answer is a big resounding no. But their job is definitely going to change. A lot. This isn't a story about replacement, it's a story about a new partnership. Just look at how the skills break down. AI is absolutely brilliant at finding patterns in huge amounts of data and doing it with incredible speed and precision. But what about us? Humans are all about context, empathy, building trust, and making those tough, nuanced ethical calls. See? They're not competing skills at all. They're the perfect partnership. And that's really the key takeaway here. The future isn't about AI or the doctor. It's about AI and the doctor.
The best doctors of tomorrow are going to be the ones who learn how to use these tools, how to think with them, not the ones who try to race against them.
So, where is all this headed? What does this future partnership actually look like in our day-to-day lives? Well, the whole idea of a hospital might change. It becomes less like a place you only go when you're sick and more like this digital guardian that's always looking out for your health.
And hey, this isn't just some crazy future fantasy. In the next 10 years, we're going to see drugs that were invented from scratch by an AI entering clinical trials. We'll see AI triage become a standard part of every emergency room, instantly sorting out who needs help first. And yeah, eventually, maybe by 2035, we could have tiny nanosensors in our blood that report our health back to our digital twin in real time.
So, when you put it all together, we can finally answer that big question we started with. It turns out the big promise here isn't to make medicine colder or more robotic. It's actually the opposite. It sounds a little crazy, but AI might just be the one thing that allows our doctors to be more human. Think about it. By letting the AI handle all the heavy lifting, all the number crunching and data sifting, it frees doctors up from being stuck behind a screen. It gets them back to the bedside to do the things only a person can do, to listen, to understand, and to actually truly care.